Children under 12 are not eligible for any of the 3 vaccines currently used in the US, and experts say the fast-spreading Delta variant has put them especially at risk, just as schools are reopening to in-person learning. With us now is Randy Weingarten, president of the American Federation of Teachers, and also Dr. Angela Myers, an expert on infectious diseases at Children's Mercy Kansas City and spokesperson for the American Academy of Pediatrics. Welcome to you both.
Thank you.
Thank you. Honored to be with you and honored to be with Dr. Myers.
After initially opposing a vaccine mandate, the union now supports requiring COVID vaccinations in schools. Why?
The circumstances have changed because of the Delta variant, and we know that vaccines are the single most important way for people to be safe. We also believe that we should be masking up at schools, as you know, the pediatricians have said, because of this variant and because kids under 12 can't get the vaccine. So we got together and we changed our policy to say we should be working with our employers on their vaccine policies and protocols, not opposing them. And so what you're seeing is that all throughout America, our members and our leaders are rolling up their sleeves and working with employers on this. And frankly, we think that this is a whole of society approach. And we're glad that Disney and United and others are doing the same thing.
Okay, you mentioned that nearly 90% of your membership have reported that they've had their shots, but that still leaves quite a number of people that haven't. Should these teachers even be in the classroom if they're not vaccinated?
Well, I think, and again, excuse me for the dog, but I think there are teachers that have real medical issues for not getting the vaccination. And if we could get to herd immunity in all sorts of different ways, and we had the exemptions for these amazing teachers who can't get it because they're immunocompromised, and we create the same kind of safeguards like we're doing for kids, I think that is going to be okay. I think what's happened is we got to get as many people vaccinated as possible. And so if there are, religious or medical exemptions, then, we can't risk losing these amazing teachers. But we also, that's part of the reason we also have to have these other safeguards like masking up and good ventilation.
Okay. Dr. Myers, over to you. We were initially under the impression that kids were not going to be as affected by COVID. Has that guidance changed?
Yeah, so it has. So, early on in the pandemic, kids made a very small proportion of people getting infected, right? It was around 2%, and then we saw it grow over the course of the year. And in the most recent weeks, it's been around 15% of infections are happening in children. So that's a huge difference, right? And there's a couple of reasons that has happened. One, the virus has become much more contagious over time. So instead of one person infecting 2 people and those 2 people each infecting 2 people, it is now one person infecting 5 people and each of those 5 people infecting 5 people. Mm-hmm. So when you have a more contagious virus, you're going to see more people being infected. Additionally, we have a huge portion, although not enough, but a big portion of the US who's had immunization. Therefore, they are protected. And now we've got a huge portion of children who are, of course, not protected because they've not been able to be vaccinated. And they are thus the people that are going to be largely affected by this and be getting infections in higher numbers. They don't have any immunity right now.
Initially, we heard that children were less at risk of developing really severe complications from COVID.
Absolutely. And they are less at risk than adults are. By far and away, adults are more likely to end up in the ICU or die from COVID-19 than kids are. However, when you see more kids getting infected, because the virus is more contagious, you're going to see more children in the hospital, more children with severe disease in the ICU, and you're going to see an increase in deaths. That just stands to reason.
Okay. Randy, in Florida, we are seeing districts challenging their governor's position on masking in schools. Is that what it's going to take to keep students safe? Educators mandating the use of masks and other protocols without the support of state officials?
Yes. But you think about these brave superintendents who now know that if the Delta variant is raging in their, communities, that kids under 12 can't get the vaccines. We know that masks, no one wants to wear a mask. And, I'm an asthmatic. I know how labored it is to breathe with a mask. But we know, if we know that this is what is going to help stop or eradicate or stem the tide of transmissibility with this contagious disease, then we have to do that to keep people safe. And the more we do that now, the faster we're going to be able to get rid of our masks.
Dr. Myers, bottom line, just how risky is a no mask setting for kids in school?
Yeah, a no mask setting is risky. So we know that schools have done a phenomenal job over the past year, right? We had an entire school year where we had kids in school, out of school, doing remote learning, some hybrid learning, and then back in school again. And what we know from the data is that when kids were in school full time, they learn better, their mental health is better, and we can protect them if we do the mitigation measures like wearing masks, like frequent hand washing, like, cleaning high touch surfaces and screening before we come to work and to school each day to make sure we're coming healthy, right? We're not coming with symptoms. So, the data's in, we know it works. And as, Randy mentioned, people don't want to wear a mask, and I get that. And people are tired of doing it. But the fact is we know what the right thing to do is, and we know how to keep kids safe and keep kids healthy and keep them where they need to be, which is in school.
The benefits of being in school are clear, and we need to make sure we have an availability for that for all kids. Hybrid learning does not work. And so we need to have all kids in school. We need to have masking. We need to have good ventilation. And the thing about physical distancing is that you can actually have a 3 feet. Most classrooms can actually accommodate 3 feet physical distancing. And we should just be ingenious about using different spaces to be able to do that.
How difficult would it be to mandate the COVID vaccine in schools? After all, kids need to show proof of other shots received before a new school year starts.
Yeah, so that's a great question. I don't see that happening before it is approved, and what that approval is going to look like, at what age it's going to go down to, and when it's going to happen. We still don't know, right? There's some thought that it could be happening very soon. There's some thought that it might be all the way down to age 5, but we don't know that yet. There are multiple vaccines that are required for school, and those have been shown over decades to save lives. Millions of lives have been saved by requiring kids to get the MMR vaccine, for example, preventing measles and mumps and rubella. So, I think that it's certainly something that could be considered in the future, but I don't think it's going to be considered as an immediate option. I think we still have some work to do to get through the approval process and continue to move forward.
Okay, a final question for each of you. Dr. Myers, do you believe we'll see a vast difference in the rate of infections in middle, high schools versus elementary schools, since the older students will have access to vaccines?
That's a great question. I don't know at this point. Unfortunately, even though the vaccine has been authorized all the way down to age 12 since early May, we have not seen as many adolescents take advantage of it as we would like. So what I would really like to stress, it's less than half. So what I'd really like to stress is there's still time. Get your vaccine. You may be starting school before you're fully vaccinated, and that's okay. You're going to be using your mitigation measures, but please consider getting the vaccine now, because the sooner you get it, the sooner you're protected, and you're protecting your peers at school. And you want to play your sports, and you want to do your after school activities. You want to be on the yearbook and the plays and all of the things. So this is what gets us there.
Yeah. And Randy, what level of normal should your teachers and students expect this year? Are they having to rethink their engagement?
What has happened over the course of the last few weeks is that those mitigation measures that we thought would have been in the rearview mirror, they're not. Let's bring them back, and let's make sure we have them so we can have as good a school year as possible. We know the benefits of being in school. We have to make sure that we make it safe and healthy for our school community, for our kids, for our parents, and for our educators. And I think that if we can do that, then we're going to see a real change in this country from the fear and agitation we have right now to a sense of confidence that we are taking care of our kids.
All right, Randy Weingarten, president of the American Federation of Teachers, and Dr. Angela Myers of Children's Mercy Kansas City and spokesperson for the American Academy of Pediatrics. Thank you so much.
Thank you.
And I'm Mabel Jong. Thanks for watching.